Did you know that 20% of kids under the age of 5 have cavities? And that 50% of kids between the ages of 6 and 11 also have cavities? But wait, more than 50% of kids between the ages of 12 and 19 have cavities. Now, what about adults? 90% of adults have had at least one cavity. And surprisingly, 1 in 4 adults around you have untreated cavities. I know these numbers are overwhelming, but cavities are an ongoing epidemic. Tooth decay is an active disease. However, good news is it's preventable. Hi, my name is Dr. Nick and I'm a pediatric dentist, and I am Dr. Little Smiles. In today's video, I'm going to tell you what is a cavity and how it happens. I'm also going to tell you what it feels like and what it looks like in your mouth. We're going to cover what factors are involved in causing a cavity, but also play a role in preventing them. Lastly, I'm going to teach you how cavities happen so that you can better prevent them. So make sure you stick around to the end so you can care for the smiles that matter most to you. Now, before we begin, don't forget to hit that subscribe button and turn on your notifications. This way, you'll never miss any of my smile saving tips and tricks. Let's begin with the basics. In order to know what a cavity is, we need to know what a tooth is made of. The tooth is actually made of 3 layers, the outermost layer being the enamel, the strongest of all 3, the second layer being dentin, not as strong as enamel, and finally the third most layer, which is the most important layer, the pulp. This is where we find all the nerves and vessels. This is actually the heart of the tooth. Now, when you get a cavity, it starts from the outermost layer. It starts to break down enamel. The enamel breakdown is in fact a cavity. And now I know you're wondering, how does enamel actually break down? So how does a cavity actually occur? Well, in order for the enamel to be broken down, it needs to be attacked. So who are the attackers? The attackers are in fact a bacteria known as Streptococcus mutans, which attacks the enamel with the production of acid. This bacteria produces acid, which in result breaks down your enamel. However, this bacteria feeds on sugars in order to produce acid. Therefore, every time we eat carbohydrates, especially starchy carbohydrates, they get broken down into sugars in our mouth. This bacteria then goes and feeds on the sugar, which in result produces acid. And that acid, in fact, breaks down the enamel. Now, just like everywhere else in our body, we do have good bacteria and bad bacteria in our mouth. It is the growth of this bad bacteria that eventually leads to disease formation. In the case of cavities, we have a growth of this Streptococcus mutans bacteria that eventually results in producing more and more acid and hence more and more enamel breakdown. So, to sum it up real quick for you, when you eat carbohydrates, especially starchy carbohydrates and sweet carbohydrates, you will eventually break them down into sugar. This sugar will then feed this cavity-causing bacteria, and it is this cavity-causing bacteria that will then produce acid. That acid will accumulate in your mouth and eventually start to dissolve and break down the enamel. As the enamel gets broken down, the damage will eventually make its way into the dentin, the second layer, and finally into the pulp, the heart of the tooth. Now, just like every battle, there are attackers and there are defenders. The attackers we already covered, but what is our defense? Our defense comes in the form of saliva. Saliva is packed with nutrients and minerals, antimicrobials, immune cells, as well as components that will help neutralize the acid. Now, saliva itself actually also helps wash away the food and the bacteria that is found in our mouths and on the surfaces of our teeth. So to sum it up, saliva will wash our teeth, neutralize the acid, fight off the bad bacteria, prevent infection, as well as provide minerals and nutrients for our teeth during the rebuilding process. Now, one more thing, throughout any given day, we're constantly in a state of demineralization and remineralization. That means breakdown and rebuilding. Every time we eat, the bad bacteria is actually producing acid and breaking down our enamel. However, quickly after, we have saliva that comes in and helps in the rebuilding process. However, if this balance tips towards the demineralization, aka the breakdown, and it happens consistently over time, you will eventually start to break down more and more of enamel and not be able to rebuild it back, turning into a cavity. Okay, so now that you know what a cavity is and how it actually happens, let's talk about what a cavity looks like and feels like in your mouth. Well, first of all, if you're just gonna look in your mouth and try to find all your cavities, that's probably not gonna happen. Cavities are in their initial stages and they're very hard to detect. Even me, I would need to use my instruments as well as x-rays sometimes to catch those initial cavities. However, the way it actually all starts is when the enamel is just starting to break down or weaken, it will appear as a white chalky appearance. But even at this point, the tooth may just look smooth with no holes or craters. In some cases, yes, as the cavity gets deeper, it will start to form little holes or little craters. Now, as this cavity gets deeper and deeper and makes its way into the second layer of the tooth, at this point, the hole and the crater are quite large. These cavities are much more advanced. In terms of what they feel like, this is different for everyone. In some cases, people won't even feel cavities until they're very advanced. Whereas in certain cases, cavities at even the initial stages will cause some sensitivity. The sensitivity usually happens to cold and hot foods and beverages, as well as to sweet foods and beverages. However, this sensitivity turns into pain It could be random pain, it could be nighttime pain, it could be pain on chewing when the cavities are getting deeper and deeper. Either way, whether you notice a whitish, chalky appearance or a sensitivity to hot, cold, or sweet, you should immediately go see your dentist. And this is why we recommend regular 6-month checkups, because it allows us to catch these cavities at their initial stages and treat them at the appropriate time. Okay, so now you know exactly what cavities are, how they happen, what they feel like and look like in your mouth. But now it's time for the good news. Yes, cavities are preventable. So this means that we can actually prevent enamel breakdown. And yes, if this breakdown is still in its initial stages, we can actually prevent its progression so that it doesn't turn into a hole and that you don't need dental treatment. In order to figure out prevention of cavities, it's simple. Just think of what causes them. We know that food plays a huge role in causing cavities. How you eat and what you eat is super important. So start thinking about the starchy carbohydrates, the sweet foods, as well as the acidic foods and beverages that you consume. We also know that the bad bacteria is the most important attacker, which means we need to reduce the amount of this bacteria in our mouth. And in order to do this, we need to brush well and floss well. Another component of prevention is saliva. The more saliva we have, the more of our defense will be present. This means sucking on a sugar-free mint, drinking lots of water, eating foods that stimulate saliva will all help us fight off cavities. Last but not least, your lifestyle, your habits, as well as your genetics also play a role. Smoking and vaping will reduce saliva production. Your genetics can actually influence the quality of your teeth. So having a nutrient-rich diet with calcium, vitamin D, vitamin K2 will all help build your teeth stronger and maintain their health. Okay, so this was a very basic explanation of prevention. However, in my other videos, I dive into what foods you should and shouldn't eat, what type of hygiene practices you should be practicing, also which products are useful for protecting your teeth and which ones are completely useless. So make sure you stick around. Don't forget to subscribe to the channel and turn on your notifications. Also, if you found this video useful, make sure to share it with your friends and family and give me a thumbs up.